Welcome to Founder Fridays on Evolve, where we interview founders about the startups they are building to push the world to evolve. Welcome to Founder Fridays on Evolve. Today I have Kimberly Knotson, founder of Global Mentality, a medical startup looking to improve access of healthcare for all individuals, especially those suffering from mental health disorders. So welcome to the podcast, Kimberly.
Thank you. Thank you for inviting me.
Absolutely. So tell me a little bit about you and why you're so passionate and driven about tackling this problem.
Okay. Well, I'm a registered nurse. I've been a nurse for almost 11 years. 6 of those years I've actually spent working as a psychiatric nurse at the State Psychiatric Hospital here in Augusta. And I fell in love with it. I was kind of thrown into it, but once I got into it, I fell in love with it. So I love psych nursing. And one of the biggest things I saw is that individuals would get treated and they would get healthy and go back out into the communities and they would be right back. So this is kind of the solution for me, a solution to providing care for these individuals or support while they're actually in the community.
Yeah, so tell me a little bit more about the problem that you're focusing in on with your company.
One of the biggest problems with individuals who have mental health illnesses is that they go into the communities and they don't have the support that they need. They don't have support from families. They don't have support from clinicians. They may not have transportation to actually make it to their appointments. And on top of all that, there's actually a shortage of mental health specialists in the community. So the biggest things that we would like to address is to improve access to healthcare. Let's make sure that these individuals can make their appointments.
Absolutely. So what is it that your company does in order to help solve this problem?
Global Mentality Incorporated, what we are developing is a software that actually allows individuals that suffer from mental health illnesses to actually attend their appointments, but from the comforts of their own homes. So they'll be able to see their nurses, their clinicians, their therapists, their entire medical support team through the use of a smartphone, a tablet, a laptop, or any type of device in which they can get Wi-Fi or anything like that. So they'll actually still be able to attend their appointments. They'll be able to self-schedule their appointments based off the clinician's availabilities, and they'll also be able to use in-app messaging. So maybe they have a question about medications, maybe they have a question for their therapist. They'll be able to actually message these individuals directly.
Yeah. And so have you guys had any users yet? What sort of traction have you been getting?
No, right now we're still in the phase. We've been up and running probably since July. So we're actually still in the phase of development. So hopefully within the next 3 months, we'll have an MVP out, and probably within the next year, we'll have something developed based off the MVP or results from the MVP.
Okay. And so where do you see the potential growth for this in the marketplace?
Well, I hope and pray that it's telehealth is kind of the way to go right now. So I really hope and pray that we make a significant impact in telehealth, the word of telehealth, and healthcare as well.
And then, hold on, sorry. What gives your company the competitive edge?
I think the biggest thing with our company, and I don't want to really say competitors, because to me they're more like mentors or companies that can show me the way to go because they've been where I am now. But I think one of the things that make us different is that instead of focusing on emergent care or emergency situations or urgent care situations, we're more focused on the individuals establishing a rapport with their clinicians. So whenever you have an appointment, you're seeing your same clinician. So your clinician knows you. They know what you typically look like. They know what you typically sound like. So if something looks different, then they're able to say, hey, okay, we need you to come in right now. Or, hey, we need to schedule an appointment for you to come in. So I think that's one of the biggest things, because our goal is to establish a rapport with the community clinicians, because the community is where the broken piece is. And that's where we need to hone in on kind of making sure that we increase the support system.
Yeah, and then where can people get involved if they want to do more with you guys?
Well, Global Mentality Incorporated also has a nonprofit organization called Global Mentality. So our focus is to definitely spread mental health awareness. So we participate and host several charity events. So if you want to get involved directly, definitely check us out. Our Facebook, our email address is globalmentalityincorporated.com. You can check us out on Facebook. You can use Global Mentality or Global Mentality Incorporated. And we usually post any of the upcoming events we have. And if you would also like to get more information, definitely check out our website as well.
Awesome. So what's the biggest struggle that you're having right now in this startup phase?
The biggest struggle I'm having is probably funding. Most of the funding, as far as app development, the MVP, most of that has actually came directly. It's been a personal expenditure, so I've spent probably the majority of the money. As far as Global Mentality, a nonprofit, we have been effective in fundraising, so that's been really good. But the biggest thing has been funding, not really having any funding support or financial support.
Yeah, absolutely. And then what about you as a founder? Obviously, the business is only as strong as the person at its head. So what have you been struggling with personally?
I think the biggest thing I've been struggling with is learning how to kind of let other people, I don't have to be directly involved in
Mm.
everything. I have a wonderful COO, and her name is Hope Michelle, and she's really stepped up. And if she see me kind of, struggling, and she'll pick up the pieces. It's always what do you need me to do? But that's the biggest thing because I'm a mom, I'm in school, I work full time, so and then it's the business, and I love to give everything I can my all. So whatever I do, I want to give it my all. So having to just kind of step away and let other people kind of step up is probably one of my biggest struggles.
Yeah. Well, thank you so much, Kimberly. And guys, if you want to join in on the conversation or have any advice for Kimberly and Global Mentality, please drop it in the comments below. We want to get as much awareness and help and support to these founders and startups as we can. So thank you so much, Kimberly, for coming on the show today.
Thank you.